How do kidneys cause hematuria? Imagine your kidneys as tiny, highly efficient filters working tirelessly to clean your blood and produce urine. Sometimes, something goes wrong inside these filters, leading to blood showing up in your urine, a condition called hematuria. To understand how this happens, we need to look at the structure of the kidneys and how they do their job. The key players are the glomeruli, which are tiny clusters of blood vessels that act like filters. These filters normally prevent red blood cells from passing into the urine. When everything is working well, your urine should be free of blood. But if the glomeruli get damaged or inflamed, blood cells can slip through and end up in your urine, causing hematuria. One common way kidneys cause hematuria is through glomerular diseases. Conditions like glomerulonephritis, which is inflammation of the glomeruli, can damage the filtering barrier. This inflammation might be caused by infections, autoimmune responses, or other immune system issues. For example, in autoimmune diseases like lupus, the immune system mistakenly attacks the kidney tissue, leading to inflammation and blood leakage. Similarly, IgA nephropathy involves deposits of immune proteins in the glomeruli, which can cause inflammation and bleeding. Structural damage to the kidneys can also lead to hematuria. Sometimes, genetic conditions affect the cells that make up the glomeruli, such as podocytes, or weaken the basement membrane that supports the filter. These abnormalities make the filter more fragile and prone to leaks. Inherited disorders like Alport syndrome are examples where genetic mutations cause structural defects, leading to blood in the urine. Toxic deposits in the kidneys can also cause damage. Certain diseases involve abnormal buildup of substances like immune proteins or fibronectin in the glomeruli, which can trigger inflammation and damage the tiny blood vessels. When these structures are compromised, blood can escape into the urine. Infections are another cause. Kidney infections, known as pyelonephritis, can inflame the tissue and blood vessels within the kidney, resulting in bleeding. This is often accompanied by other symptoms like fever and back pain. Physical injury or trauma to the kidneys is another factor. Kidney stones, which are hard mineral deposits, can scratch or damage the lining of the kidney or urinary tract as they move through. Similarly, blunt trauma from accidents can cause blood vessels to rupture, leading to hematuria. Inherited conditions like sickle cell disease can also affect kidney blood flow and structure, increasing the risk of bleeding into the urine. These disorders can cause damage over time, making hematuria more likely. When blood leaks from the kidneys, the red blood cells often look abnormally shaped because they are deformed as they pass through damaged glomeruli. This is called dysmorphic red blood cells and helps doctors identify that the source of bleeding is from the kidneys. In contrast, if the bleeding comes from lower parts of the urinary tract, like the bladder or urethra, the red blood cells tend to look normal. In the context of bladder health and bladder cancer, it's important to understand that hematuria can originate from the kidneys or from the lower urinary tract. While kidney issues often involve damage to the filtering units, problems in the bladder or urethra, including bladder cancer, can also cause blood in the urine. That's why doctors carefully evaluate the source of hematuria to determine the right diagnosis and treatment. In summary, the kidneys cause hematuria when damage or disease disrupts the delicate filtering structures, allowing blood cells to leak into the urine. This can happen due to inflammation, infections, structural abnormalities, or inherited conditions. Recognizing whether the blood is coming from the kidneys or elsewhere in the urinary tract is key to proper diagnosis and management. If you notice blood in your urine, it's always best to consult a healthcare professional for a thorough evaluation to find the cause and get appropriate care.